to get to know yet. Billy, shall I introduce myself or do you introduce me?
All yours, Lisa.
Great. So again, for those of you I haven't had the chance to meet, my name is Lisa Tepper Bates, and I'm the president and CEO of United Way of Connecticut. And among the work that we do, just to give you a little orientation, we provide the 211 service for Connecticut. That's a 3-digit extension you can call if you need heating assistance, if you're facing homelessness, for example. We also provide the service known as 988, which is the National Suicide and Mental Health Crisis Lifeline for Connecticut. We are the administrator of Care for Kids, the state of Connecticut Child Care Subsidy, and we also provide the state database and information and referral service for child care, known as 211 Child Care. In a separate capacity, we are also the Association of United Ways of Connecticut. There are 14 local United Ways, and we are the association. And together, the Connecticut United Ways are a partner with the National ALICE project. And that's what we're all here to talk about today. ALICE stands for Asset Limited, Income Constrained, but Employed. And ALICE, the shorthand I would provide to you is that ALICE really is an alternative way to think about who is struggling and why. ALICE was largely founded so that Americans could think about who's poor in our country, who is struggling. Other than ALICE, most people rely on the federal poverty line. And I see we have some people here who are statisticians, and they can tell you that the federal poverty line tells you nothing about the true cost of living. So ALICE was developed as a methodology to provide real insight into what it costs to make ends meet in a specific community. So I'm going to share a slide deck, and I'm going to go through it quickly with you. But just to orient everyone around what ALICE is and what our most recent ALICE report showed in the way of insights. I hope that's okay. Billy, I can share, I think.
You should be able to.
Great.
Perfect.
Okay, hopefully you can see the screen, yes?
Should be good.
It's always good to check, I find. Super. So again, we're going to talk about ALICE, and you see here alice.ctunitedway.org is the website. I believe these slides have been shared or will be shared with the full Governor's Workforce Council. So please know that if there's anything here of interest, you don't have to take notes. And it's helpful later if you'd like to go to that website because at that website, there is an interactive map you can use to really dive in to the specifics of data in specific parts of the state. So I'm sorry, there's a draft mark on here. I'm not sure why. That's a mistake. This is not actually a draft, so apologies for that. The key findings of the report are here. Financial hardship of Connecticut households, unfortunately, does continue to grow. This was our 10th year providing the ALICE data in the state. And we have seen the number of households who are at this line we call ALICE, just making ends meet or falling behind. That continues to be a bigger share of the state with each report. The problem is the mismatch between wages and the cost of basics. We continue to see that racial and gender disparities persist. There's specific impacts of the pandemic and the set of benefits introduced out of the pandemic that now have been backed away that have an impact visible in this report, which I'm reviewing with you based on 2021 data. And we do see that the rising cost of household essentials is putting financial stability further and further out of reach for many families. So this map, which again exists at alice.ctunitedway.org, is interactive online and shows you across the state that while the percentage of ALICE households varies, it is 39% across the state as a whole, as high as 68% in some parts of Connecticut. And so what is it that drives that? And what we have for you here is the Alice household survival budget for a typical family, a working age family of two parents with two small children. These costs, again, are from 2021. We'll have a new report, by the way, coming out this coming fall. But these data show you in detail, based on credible data sets and real numbers, what it takes to make ends meet. What you see here, and we'll talk about a little bit more at the end of the presentation, is the fact that in that particular year out of the pandemic, there was an enormous amount of additional support from the federal government through the enhanced child tax credit and the enhanced child independent care credit, as much as $15,000, as you see here. Most of that is not available to families in either in the last tax year or in the current tax year. So just quickly, and again, this will be made available to you if you'd like to review it. And if you have any questions, you're always welcome to reach out. But just to show you, these are the different data sets from which the information for this report is gathered, all of which are very credible, and some of which are actually very conservative. Every time we bring the report out, we are told that the housing numbers are simply not realistic. Some of you here have real expertise in housing, like Greg Ugaldi. Hi, Greg. And you will know that the HUD estimates for what is deemed to be fair market rent is a very low estimate of how you could pay rent and get by. So those are the numbers we use. In fact, pretty conservative, even though it seems like a big number when you see what that budget amounts to. So as you see here, there are a number of different data points that continue to reflect the numbers that I'm giving you, that about 40% of the state is struggling just to make ends meet. And this separate number, 41% of Connecticut struggling households only had emergency savings in 2021. That's a staggering number, but true. And by the way, one of the shortcomings of our data is that it does not account for savings or debt. We're often asked, how much debt does an Alice household have? We can't tell you that yet. Our national Alice partners are working on that. We know that some of these households, in addition to struggling with their current bills, are also living under a debt load that they may or may not be able to sustain over time. So in terms of key findings, as you've already heard, financial hardship continues to grow. These are the national and the Connecticut shares in terms of Alice, and also the population that is living either at or below the poverty line. Additional key finding, the mismatch between wages and the cost of basics is what drives this. So as you'll see here, we show a chart for 8 of the 20 most common occupations in 2021. And as you see on the side, 60% of the top 20 jobs, in terms of how many people hold that job, paid less than $20 an hour. So that's $40,000 a year. Two working parents with two small children, each working at $20 an hour, would fall very far short of what they need in terms of our budget calculations to make ends meet, driven mostly by the high cost of childcare and the high cost of housing. Rates of financial hardship in our state differ substantially by race and gender, which is true for the country as a whole, but also true here. In our state, we know that Black and Hispanic households in particular have very high percentages of Alice, and 68% of female-headed households with children live below the Alice threshold. These numbers are fairly consistent year to year. I would note to you that the Hispanic numbers fell slightly, we believe largely due to the different collection of data through the census that allowed for the category called multi-ethnic. So some people who probably defined themselves as Hispanic previously are in that much vaguer bucket now. So I just wanted to mention that to any of you who followed along. That previously was at 63% of Hispanic households before the last census. So in terms of the pandemic-related enhanced benefits, it's really important to reflect on what was available and is not now. A great number of Connecticut families in this past tax season were simply shocked by how little would come back to them once they filed their taxes. And that is because of the expiration of so many of these benefits that were available for a short time only. The enhanced child tax credit was a particularly successful mechanism, as you may know, in terms of combating child poverty in America, sadly expired. The enhanced dependent care tax credit was another mechanism that was very, very important for those families who are currently trying to pay for childcare and go to work. The rising cost, and this is something I took a note during the presentation. The Department of Patrick from the Department of Labor had a chart that showed, according to the CPI, the Consumer Price Index, that during 2022 prices were increasing by about 9%. The Alice team at the national level reflects differently on the effective rate of inflation that our households, Alice households, experience. To get the Alice index, they focus really only on the costs that Alice households must bear. The Consumer Price Index, as some of you probably know, engages something on the order of 200 different categories of goods. Alice households are not paying for 200 categories of goods. They really have a very limited number of items they are paying for: rent, transportation, medical costs, childcare. So if you home in on those costs that you saw in the Alice budget, their effective rate of inflation between 2021 and 2023 was 18%. So if we take the 2021 Alice estimate and apply that effective rate of inflation, then our best estimate is that in the 2023 year, that same family was going to need about $126,000 just to afford the basics. And we have a chart here that shows you over time the way we have seen the Alice household survival budget increase, specific again to Connecticut. Increases also for single adults, but the increases for families have been much steeper over time. So we hoped to ask of all of you to discuss with us these two questions. What state policy changes would you prioritize to increase the financial well-being of Connecticut households who are living paycheck to paycheck or falling behind? And we also wanted to see if there were some creative ideas in this category. We know there's a cost to businesses that employ Alice. And I say this because we are also, as United Way of Connecticut, we do the best we can to pay competitive rates. We work almost exclusively on state contracts. Most of our staff are also Alice. We know that there are stresses borne by those households, and those are stresses that sometimes transfer to businesses. We understand that, and we know there are no easy solutions, but we're very interested to hear what thoughts might be able to surface here about how to work together with employers to find creative ways that we can collectively provide support for Alice households. If we're able to do so, we believe they could be more productive as workers for all of us, as well as engaging less stress as Connecticut residents trying to get by. So thank you. I'm happy to answer questions on the presentation or the data, or happy to hear thoughts. Billy, will you be the moderator, or shall I continue as moderator of the discussion?
Please continue, Lisa. I can chime in as needed.
Great. So please, I'd be glad to hear your thoughts. There's a lot of smart and interesting people here. I'd love to hear thoughts or questions, anything that you'd like to pitch in.
Hi, Lisa. Thank you so much for the presentation. So informative, and all the work that you do around this. I think what is a really a priority for OWS is to help support families over the benefit cliff. I think the benefit cliff really keeps families in a low income rate. I know just in some of the employees in my family business that come in and say, I can't accept a raise because I'm going to lose my benefits, is really sad. And so I think that's something that as a state, we're hoping to be able to move the needle on that. And I would also say, you know, the tax credits and especially the child tax credit and those enhanced tax credits are really important. And I think tax credits are also a way to support and incentivize businesses to help their employees overcome some of the benefit cliffs that they have. You know, instead of giving them that maybe $1 an hour raise, they might need to give them a $2 an hour raise at one time so that they can mitigate the benefits that they're going to lose.
Yeah, thank you, Kelly, for lifting up both of those important subjects. Benefit cliffs uh, are a big problem, not just here, but across the nation. So thank you for lifting that up. And also tax credits. For those of you who might not have seen our advocacy around the creation of a child tax credit at the state level in Connecticut, we firmly believe that that's an important vehicle that would be of great help to families. And just a little bit of history on that. A couple of years ago, you may recall that the governor and the legislature offered a one-time child tax rebate of $250. We had uptake in the state of over 80% of eligible people because they actually had to apply. It was not as easy as we wish it could have been. And yet 80% of people were willing to do quite a bit of work to secure $250 per child for up to 3 children. $250 means a lot. Together with the advocates who stood behind the child tax credit, we were looking for $600 per child. And we'll see what happens next session. But please know that Connecticut would not be a leader in adopting a child tax credit. We are unfortunately a little bit at the back of the pack. We are now the only state in America with an independent state level income tax with no tax policy to support families with children. So this is an area in which we're following and not leading. I know all of us here are very proud of Connecticut's leadership, and we do lead in so many areas, just not here. And great, I see a couple additional comments, and I'm not sure. I think Ed, you might have been first, please.
Well, I feel as though I'm preaching to the choir here, but the choir knows the singing. But the child tax credit is so important to our working families that are struggling, and a real child tax credit that we have, and one that is automatic and that people don't have to apply for would be ideal. The less hoops that people have to jump through, especially when they are Alice, and I thank you for the Alice report. I reference it all the time when lobbying legislators that the Alice report is something they need to read. And it should be required reading, in my opinion. But thank you for all of your advocacy. And as president of the Connecticut AFL-CIO, we're right here with you. With Alice is the real poverty threshold. And thank you. And we'll do whatever we can to push for that.
Thank you very much, Ed. I appreciate that. And for your knowledge and others here who we know make use of the Alice report, the report used to be on a 2-year cycle. Starting this fall, it'll be issued every year. So we're very excited about that because it'll keep that data fresh, especially in years when there are big swings in the cost of living. Terrific. I think it looks like Melvette. Hi, Melvette. I think you're next.
Hi. I'm sorry. I hope that you can hear me okay. My computer has been acting a little funny. I think it gets tired of Zoom. It's like, I'm so tired. So I would agree. Kelly and I have been doing that work along with their 2Gen Advisory and OJWS and a lot of partners at the table around benefits cliffs. The thing I would add about that, and as we have conversations, that we're very specific about what we're asking for, right? And there are some big things that we need to ask for, and there are some smaller things that we need to ask for. So I'll give you a personal example. My son, adult son, who is on Husky D, the adult health insurance for the state, he works at Home Depot. You know, he's one of those folks who's living paycheck to paycheck. We gets to live in a multi-generational home. You know, he also is on the autism spectrum, very high functioning, right? And so he doesn't have access to services because he's always the in between, right? He's kind of like, I don't have as many health or disability needs as someone else, so I don't get those services, right? I'm very high functioning and I'm able-bodied, I can work, but I really can't afford to live on my own because whatever. And so he recently got kicked off of Husky because he made just a little too much money. And he didn't know about it until he got a bill from the hospital, right? He had an emergency room interaction. And so when we're talking about this benefits cliff piece and we're talking about people who experience it, the notification that they get is like, you have been taken off, right? In many cases, they're not getting it ahead. And so even if we can make some policy changes where someone gets to that income threshold or whatever, that we give them time, right? So it's not like you're off immediately, or hey, by the way, you were off and you made that dollar extra, and that goes back to like 3 months ago. But giving people time to understand that and then adjust, right? So they can make some decisions. Okay, now I need to go get another job, or I need to do whatever. So I think that's one thing. Also, things like families living paycheck to paycheck need cash in their pockets, right? Because they're living paycheck. So how can we get more money into their hand? How can we get more, income into their hand so they're not experiencing all these things, right? Things like the motor vehicle property tax. Do we really need that? Like, literally, I know, right? But do we need to be taxing people on vehicles that help them get to work? I'm just saying, right? We're fighting against ourselves in some ways. I'll stop there. I know we have limited time.
Thank you, Melvette. And I think that better warning for people who are falling off of certain benefits, that's a very, very good point. I don't know what we can do about the car tax, but I think that that's a great point as well. It's transportation to work. Greg Ugaldi.
Yes, just quick. I'm looking at the timeout in 30 seconds, but one of the things that amazes me is the shortage of food in households. My wife is a town clerk and the food pantries are overtaxed. And if there's anything we could do to incentivize small businesses and businesses to help provide for these food needs, it would be appreciated around the state, I'm sure.
It's an excellent point. Carol, I hope we have time for you.
All right. Hi, everybody. Thank you so much for joining us today at our second quarterly Governor's Workforce Council meeting. We hope that you enjoyed the presentations. I want to thank you all for sticking through our technical problems, and we'll make sure that that doesn't happen again. And encourage you all to put a hold on your calendar for September 12th, late afternoon, as we will have an in-person meeting the next time, and we're very excited to see you all in person. It's been a very long time. And then for our GWC members, please be on the lookout for an email for our WIOA vote. We will need a quorum to have that vote, and it will need to be an in-person or a virtual meeting vote. So again, thank you all so much. Happy Memorial Day, and wishing you all a wonderful, safe, and fun summer.